Dr. Garcia here, one of the sports and cartilage surgeons, orthopedic specialist of Seattle. So this is an interesting testimonial. So this patient had bilateral patellar defects and also some malalignment and some history of other surgeries that were issues regarding those knees. The challenge here is almost 50 years old, and so many patients have said, hey, doctors said there's really not much to do. You get knee replacement, etc. But we don't treat MRIs, we don't just treat the age, we treat how the cartilage status is. And in his knees, both the rest of the cartilage was great, minus the patellas and the malalignment. So we talked about doing a tibial tubercle osteotomy and a patella transplant, which is not a joke of a procedure, especially as you get older. And we decided to do one knee. He did so well on the other knee that he actually asked to have the other side done. And so we did the exact same thing. Again, some considerations to each knee. And you can see he's almost a year out from the final surgery. He's doing quite well, better than he was before. Super happy. Again, showing that age is just a number. And overall, I've been really pleased with his results. So enjoy the testimonial. Thanks.
All right. So I was having a lot of pain in both of my kneecaps. It was really starting to limit my ability to do things I like to do. And even just day-to-day life, squatting down, standing up, going downstairs and stuff. So I came to see Dr. Garcia about what my options were. I had already found out from some MRIs that I had wear down to the bone in both of my kneecaps and kneecap alignment problems. We discussed some options around realigning my kneecaps and also doing grafts to repair the damage to the cartilage on the backside of both of my kneecaps.
How did you feel about the explanation of the surgeries?
The explanations were understandable. They made a lot of sense. They addressed concerns that I had about my knees going forward, and it also sounded like it was kind of the best option short of knee replacements, and knee replacements I wasn't ready for yet. So the recovery, the surgeries went smoothly. The recoveries from the surgeries the pain was very, very minimal. I did not need much pain medication afterwards. It was definitely a long, slow healing process, but I was able to start doing some therapy, physical therapy, relatively soon after the surgeries. I haven't had really any setbacks during the physical therapy process, and I've just slowly over the last year been building back my muscle strength and agility and flexibility and all of that. And even at this point, things are continuing to get stronger, and I'm slowly able to reintroduce more activity.
Right. We do this in a stage fashion. What can you do now with your knees, and how do you feel from before the surgery?
Okay. So right now my knees are both doing pretty well. I mean, in day-to-day life, I have very little pain. Pain's much less than it was before the surgery. Squatting down, standing up, going up and down stairs, those are all largely pain-free at this point. And before the surgery, things that I like to do, like skiing, or climbing in the gym, rock climbing generally, hiking, those things, and bicycling, those things had all become fairly painful. At this stage, after a year or so of recovery and rehab, I'm now able to climb in the gym with essentially no pain. I have been able to do a little bit of skiing this winter, despite the terrible ski season. I've been able to do a little bit of biking. Things still get a little sore afterwards, but it's much better than it was before the surgeries.
If you had a friend at a similar condition and they recommended this surgery for them, would you recommend the surgery?
Yes, I would.